everybody, welcome to my channel. Today we're gonna talk about Alzheimer. I'm Rita and today it's all about you. Alzheimer is a type of dementia, but it is also the cause of the dementia. And this dementia is a broad theme for symptoms like the loss of memory and confusion. In general, dementia includes Alzheimer's, Parkinson's, brain injury and other kind of brain diseases. Alzheimer's disease is irreversible, progressive brain disorder that destroys memory and the thinking skills and the ability to carry the simple acts in life or the simple daily life routines. Alzheimer is not the normal part of the aging process, but it is a disease that has the age has a risk factor. But it is not exclusive of the old age. In US, around 200,000 people can eventually have symptoms of Alzheimer's disease from the age of 30 to 65 years old. And this, of course, present as the young stages of this disease. Alzheimer's is the most common type of dementia that really worsens over time, and it can start with light episodes, which the main symptoms are the memory loss that begins slowly and ends affecting the whole daily life and really turns difficult activities like taking care of themselves in terms of hygiene or in the normal routines in life. Another symptom is difficulties in problem-solve skills, speech trouble or writing issues, become disorientated in time and space, decreased judgment, personality change and the mood changes like apathy or aggressiveness, and withdrawal with family, with friends and with the community in general. Expert researchers, scientists and doctors in general, they cannot determine the cause of this illness. But there are eventually some risk factors like age, family history and genetic that can influence the start of the disease. But having one or more of these risk factors, it doesn't mean that a person will turn into Alzheimer's disease when she will grow older. In the genetic risk, there is a particular gene which calls APOE linked to Alzheimer's disease, but it only makes the risk higher of having this disease, not really give a certain that this will happen. In general, the causes for Alzheimer's depend on the type of the brain changes that may occur. Study shows that along with the external visual effects, Alzheimer patient may develop an abnormal clump and neurofibril tangles, which actually are the main feature of Alzheimer's on the brain. Also, there are the loss of the nerve cells connections, which turns visible the synapse alterations in the hippocamp, which makes the nerves die in different parts of the brain, particularly in the final stages of the disease. Another feature is the brain shrunk. And of course, if there are less activity on the brain tissue will shrink significantly. The Alzheimer's disease has 7 stages, from the mild ones until the severe ones. Usually a person that is diagnosed with Alzheimer, she will experience all the stages, and for that can eventually take around 10 years for this to happen if it is a person with less than 80 years old, but also can occur between 3 or 5 years if the person is older than 8 years old. This disease is ranked as the third cause of death among older people worldwide. On the last stages, Alzheimer's patients, they cannot really communicate and they are totally dependent on others. And in the end, the body starts to shut down until the totally failure of the vital organs. To diagnose this disease, it's necessary to start with a brain examination, and usually a doctor starts with a very simple cognitive tests to assess the short-term memory, long-term memory, orientation on time and on space, and physical examinations like MRI, computer tomography scans and PET scans in order to change the brain formation and the morphological changes. Alzheimer's disease has no cure, but there are treatments that help with the symptoms and delay the progress of the disease. Depending on the diagnosed stage, the type of medicines can be related with the neurotransmitters to aid memory, or eventually other type of treatments, they can eventually block the chemicals that kill the brain cells. It is very common also that the healthcare provider will give some antidepressants to the patient, anti-anxieties or antipsychotics medicines, because the whole chemical imbalance can eventually cause depression, anxiety, restless agitation, aggression, and even hallucinations. In addition to all this medication, it is eventually necessary to change the daily life routines and give the families a help to cope with all of these changes, like starting to focus in one task at a time, limiting confusion and avoid confrontation, get enough rest and have sleep quality, and try to keep the person as calm as possible. To prevent Alzheimer, what we all can do is to look at our quality of life and try to change it to a better one, like having a nutritious, rich diet, physical activity, social engagement, and high mental stimulation during lifetime. And all of these simple things can eventually may reduce the risk of the cognitive decline that Alzheimer's disease is known for. So in the end, it is important to retain that to prevent Alzheimer, that is a disease with no cure, we may focus in the healthy lifestyle with a satisfactory quality of life that eventually may help avoid this kind of disease. And so that's all for today, guys. I hope you like it. I hope you subscribe to the channel, give a thumbs up, share with a friend, comment if you want, and I'll see you next time for another video. Bye!